My name is Dr. Sida, and today I'm going to be talking about how to prevent cervical cancer. Cervical cancer is the fourth most commonest cancer globally, and in 2022, about 350,000 women died from cervical cancer. In Nigeria, about 8,000 women die from cervical cancer every year. Cervical cancer is a highly preventable, highly treatable cancer, but women are still dying despite this fact. Therefore, we must talk about it. If this sounds like something that interests you, I want you to stick around so that we can talk further. Share this video with someone you may just be saving a life. Cervical cancer is a cancer that affects the cervix, in simpler terms, the mouth of the womb. Cancers generally are a normal group of cells that usually escape the normal growth timetable that the body regulates. This group of cells have uncontrolled growth, progressive growth, and a very high tendency to spread from their origin to other parts of the body. Cervical cancer has been linked to a virus called human papillomavirus, and two strains of this virus come into question when we are talking about cervical cancer: HPV-16 and HPV-18. It would interest you to know that human papillomavirus is transmitted sexually. I'm going to repeat that again. Human papillomavirus is transmitted sexually. That means the responsibility lies both on men and women to prevent this cancer. What are the symptoms of cervical cancer? The period of HPV infection to cervical cancer, to full-blown cervical cancer, usually can take for as long as 20 years. Because of this long or this latency period, it gives us time to detect this cancer early. That's why, like I said earlier on, cervical cancer is highly detectable and is highly treatable. Now back to the symptoms of cervical cancer. One is abnormal vaginal discharge. I want to give a story at this point. I attended once to a woman who was treating abnormal vaginal discharge for a period of about 6 months. According to her, she would treat the infection, it will go, it will come back again, it will go. And she was doing that self medicating until she came to us and she was examined, and it was found that she had cervical cancer. That's quite sad. Now, there's something characteristic about the vaginal discharge from cervical cancer. It is usually watery. The amount is a lot, usually watery in large amounts, and foul smelling. This is so because the cancer cells usually outgrow their blood supply. Because of that, they die, and during this decaying process produces this abnormal vaginal discharge. Another important symptom of cervical cancer is bleeding after sex, which we usually call postcoital bleeding. In very advanced stages, cervical cancer could be present with rapid weight loss, difficulty with urination, even constipation. By the time cervical cancer has spread to major organs in the body, it could present with symptoms like yellowness of the eyes, cough, difficulty in breathing. In these cases, we call it a metastasis. It means that these cancer cells have left the cervix to invade other important organs in the body. Now, how do we prevent cervical cancer? The first thing I would say in preventing cervical cancer is to practice safe sex. Because cervical cancer is caused by human papillomavirus, which is a sexually transmitted infection, practicing safe sex would help to prevent cervical cancer. At this point, let me make a statement. It's quite interesting because the use of condoms during sexual intercourse usually does not prevent human papillomavirus. Why? Because human papillomavirus can be transmitted through skin contact. So you see, it's very good to be responsible when it comes to practices and sexual choices. Just be careful out there. Another way to prevent cervical cancer is to have your vaccinations. Now, HPV vaccinations are available according to a time schedule, and both boys and girls are eligible to take this vaccine. This would also prevent the transmission of this virus during sexual intercourse. The third thing is to make sure that every woman of reproductive age who is engaging in sexual intercourse should have a yearly pap smear. A pap smear is a special test that involves collecting cells from the cervix and viewing them under the microscope. Remember, I have said that from the time from HPV infection to cervical cancer can last as long as 20 years. So it means that with this pap smear, abnormal changes in the cell can be picked up under the microscope and necessary treatment can be given. Then, the next way to prevent cervical cancer, when an abnormal pap smear has been found, please make sure that you do well to return for follow-up visits and meet your doctor so that it can be treated and it can be followed up long term to detect any unusual changes. These are the ways we can prevent cervical cancer. If you've enjoyed this video or this video has been informative, then do well to like, share, drop a comment. I'll see you next time where we'll be discussing another important topic. Till then, take care. Dr. Sita cares.